our side, we consider to be a good thing, a necessary thing, a useful thing, or come with a cost. And in addition, there's waste involved in the current medical and healthcare system. And sort of we need to have, one response to that is that we need to have this sense of...
Is that it, Chad? Is that, does he get it?
Individual responsibility.
Yeah, why don't you go, yeah, go ahead.
So if we can, we need to find a way to engage individuals and get them involved in their healthcare with health and wellness programs. And that's one additional thing that you think we could do. Okay? Well, it's interesting that individual responsibility is the term used in this reform. The Affordable Care Act, that tax, that mandate is called the individual responsibility payment. That is the thing in the law that's holding individuals accountable for their own care. And if they don't go out and have health insurance, and if they don't do these things, they will be paying a penalty. And the U.S. Supreme Court has said that that's constitutional. The law is the law. That will be after 2014. If you don't have health insurance coverage that meets certain requirements, you will be paying a tax. So, I mean, it's interesting to hear that individual responsibility is one way that we can engage individuals and get them to care about their own health care and help solve this cost crisis. So we're agreeing, it's absolutely right, and it's something that's included in the bill. So to then say that it should be repealed and replaced is taking it another step. There's right now about 500,000, maybe a little more than 500,000 Wisconsinites who are uninsured.
Can I just...
Let me finish that point, and I'll hand it off.
Well, the only reason I'm saying that is because you say that we agree, but I would say that's not an accurate assessment of what I said.
What did you say, Jeff, that you want to clarify?
What I'm saying is that we need to have positive incentives to help people make those good choices. What's in PPACA is a negative impact for not participating. There's a difference between a carrot and a stick. And what do you think is the right way to get people to make good choices?
Well, I think this is the right way, and it's the way that has worked in Massachusetts. To go back to that example that Robert already gave. This bill will lift 340,000 Wisconsinites out of this quagmire of being uninsured and living through this life of torture because they can't afford to get health insurance or they don't live in a place where they can access health care. So I think this bill is a good way, it is a good carrot, and it is a good stick to get this problem addressed.
Pete?
Mike, you were saying individual responsibility is in the PPACA by virtue of individual mandate, the penalty, the tax, whatever we want to call it. But I think the point that we were trying to make is individual responsibility is more than just paying into a pool. Individual responsibility. I mean, I've been in this business for a number of years, and I've seen the cost of claims go up. I've seen what insurers' trend goes up, and the bottom line is, I can explain why the percentage was 10% or 12%. I can give you the parts, but there's another underlying piece, which is the aging of America. There is also the unhealthiness of America. So I think when we look at certain things where we're talking about responsibility for improving your health, earlier I said, before repealing PPACA, if I knew what was going to replace it. Well, to be fair to myself, we still don't know what PPACA is. We have 2,600 pages of legal text. The estimate in April of 2010, when the law was, a month after it was legislated, was that between the Department of Labor, the Treasury, and the Department of Health Services, those three agencies which are charged with responsibility to interpret and implement the law, the expectation was that it would take about 20,000 pages of guidelines to help us understand and implement the law. Now that we're about a little over a year and a half into it, the estimate, based on the run average of the regs that have come out to date, the estimate has now been doubled. It'll be about 40,000 pages. So I'm not gonna wait that long for us to figure out what it is. You know, I was looking at the website and I ran across, I've been to the library here a couple times. I'm a resident of Franklin. But I looked at the library project here, which there was a common council meeting back in 2008 where there wasn't the votes to fund the library, additional funds. And there was a jam-packed meeting in August 7th of 2008 where the mayor and the common council committed to finding alternative funding, and they did. And I think it's great. But all of the citizens of Greenfield had sketches of what the library would look like. They know where it would be. They know how big it would be. You didn't have the mayor and the common council out on Layton Avenue holding their arms out going, we want it to be about that big. Now go out and figure it out. That's the part that infuriates me, to say, what do we have? It's just unfathomable. We talk about, real quickly, one point. When I talk about why I don't like PPAC or why PPAC is not the answer, Representative Stone mentioned the adult children. There are a couple of good things that came out of it that I think, covering, preventive care, I think is a smart thing. We ultimately have to answer the financing, how are we going to pay for it, but I think the concept is one I would support. Let's talk about preventive care. But wellness, which Representative Stone talked about, well, PPACA provides for wellness grants. It was funded at $200 million for 5 years, 2011 to 2015. We still don't have guidelines on that. It's for employers with less than 100 employees that don't have a wellness plan in place before March 23rd, 2010. That plan is yet to be defined. That's part of what, when I said, we want the library to be that big, well, someone has to say, well, here's what a wellness plan is. So I did some of my own math. I looked at, nationally we have about 5 million employers with 1 to 99 employees. Average firm size is about 8.4 employees. And I did a what if. I said, what if 50% of the employers wanted to pursue a grant, and half of them had employees that worked 25 or more hours, which is part of the grant criteria, and say at an average cost of $75 per employee per year. How long do you think that would last? This is kind of like cash for clunkers. 3 months. So something that was very good, I thought. In the $1 trillion program, this is something that runs out in 3 months. This is why I believe PPAC is not the answer. I'm not saying we don't have problems, but this is not the answer.
Okay, so to summarize, you think we should, at the beginning and end of your stint, you talked about wellness. You talked about the importance of encouraging wellness and healthier lifestyle. So at the beginning, you talked about it in general. At the end, you talked about problems with PPACA that the different belief exists as far as that goes. And your other discussion was how long, how many regulations are involved with the Affordable Care Act.
Well, just in terms of being fair to myself to say, we want to know what we're going to replace it with. We don't even know what we're replacing, is my point.
Okay. I would say that if we were going to create new rules of the road, a new fair playing field for 18% of the economy, it ought to be a lot of pages. I mean, we spend 1,000 pages on very small legal disputes here, and all the time in the United States. So I don't think that's a very strong, compelling argument as to what's wrong with the Affordable Care Act. As far as wellness, I would be happy to expand, to find the political will across aisles to expand the wellness efforts of the Affordable Care Act. Is it a perfect law that's done everything it needs to do? Absolutely not. It barely passed. It was like passed in 6 overtimes. It was very difficult to pass. And I don't think that's a fundamental problem with it that it doesn't have enough money for wellness. That's a reason we can improve it, and the state of Wisconsin could add more. So that's not a fundamental critique of the Affordable Care Act, in my opinion. The important thing here is, as far as wellness in general,